Everyone, good afternoon. My name is Rachel Carloni. I'm a farm assistant here at UF Health in Jacksonville, Florida, and also work with Gator Care, and have been asked today to talk to you guys a little bit about the medical management of diabetes, especially as it relates to medications. So we're going to go through some kind of general information today. If I go over anything that you guys have questions about, or if I don't go over something that you guys have questions about, my email is here on the screen. Feel free to reach out to me. More than happy to answer any questions or concerns that you may have about stuff that we are going to review. So some general management principles of diabetes. I think the big thing to remember here is that there's not really just one thing that we use when we're talking about managing diabetes. So it's usually kind of a multifactorial approach and really kind of involves a whole system approach to treating the disease state. So a big thing to remember is, what is our goal with treatment? So for most non-pregnant adults, our goal is an A1C level less than 7%, without obviously causing significant hypoglycemia. Sometimes that can be a little different depending on other disease states that patients may have. Older patients or patients that do experience hypoglycemia, we may be a little more lenient. But the vast majority of patients, we're going to aim for an A1C of less than 7%. And what this A1C of less than 7% does is it really helps to prevent long-term complications of diabetes. So things like eye disease, renal impairment, nerve damage, all of those have been associated with an A1C less than 7%. So various ways to manage diabetes. I'm sure you guys have talked about this before, but definitely a healthy diet and also regular physical activity. Weight management is another big component, and the American Diabetes Association actually emphasizes this, and they state up to 15% of body weight loss for certain patients can be helpful. Another big thing is proper sleep. This is an easy one to forget about, and easier said than done, but definitely getting adequate sleep, about 7 to 8 hours of sleep a night, as well as stress management, can be very helpful in helping to manage diabetes. And then what we're here to discuss today, which is obviously medication management. So there are a lot of different treatment options for the treatment of diabetes. Just due to time constraints, we're not going to go into all of these today. But I think the big thing to remember here is that no one's diabetes treatment is going to look the same. So your treatment might be different than your parents or your spouses or your children's, because there's a lot of things that go into determining the appropriate diabetes regimen for a patient. In general, we can kind of group diabetes medications into three different types of medications determined by how they're taken. So the first group are going to be oral agents that are taken by mouth. These tend to be our first line agents. A lot of them have been out on the market longer. We have a lot of experience with them. And in general, things that are taken orally are usually pretty easy for patients to take, and kind of preferable in terms of quality of life. So these include medications like metformin. That's probably one of our oldest drugs that we're going to talk about. Been on the market for quite a while, and a lot of really good evidence supporting its use for patients with diabetes, specifically type 2 diabetes. Other medications that are given orally can be medications such as sulfonylureas. This is a class that includes medications like glipizide or glyburide, DPP-4 inhibitors. This is medications like Januvia, I think is probably the most widely known medication within this class. We also have SGLT2 inhibitors. This is one of our newest classes of oral diabetes medications. If you're someone that watches the news in the evening time, you've probably seen the commercials for these drugs. These are things like Farxiga. They help get rid of glucose out of your body in a new way by helping to excrete it via the urine. So this is a newer class, but kind of popular just because It's very, very advertised and publicized. And then our newest class of oral diabetes medications are going to be our GLP-1 agonists. So these are drugs that can actually be given either via injection or orally. So the oral formulation is brand name Rybelsus, which is essentially an oral formulation of Ozempic. Some patients prefer not to do injections, which Ozempic and similar medications are injections. So Rybelsus is the oral alternative to those. So that brings us to our second group, which are the injectables that are not insulin. And as I said, this would be things like Ozempic, Mounjaro, Trulicity, really popular medications right now, and especially within the past few years, mainly because they've shown such great evidence at helping with weight loss, as well as some other cardiovascular risk reduction as well. So really kind of hot drugs on the market right now, because they treat diabetes well, but also because they can help with other things, and a lot of buzz around these medications. And then last but not least, we always have insulin. So I think a big thing to remember is that all type 1 diabetics will require insulin because their body does not make insulin. Some type 2 diabetics may require insulin, and a lot of patients feel like the point that they get where they do require insulin may be somewhat of a failure, or maybe they weren't able to manage their diabetes with other modalities. But I think the big thing to remember here is that really no one's diabetes are the same. So this is often a just result of long-standing diabetes, and can honestly be the best way to mimic what should be happening naturally in the body. So we have various types of insulin. Most patients will be on two types. So they will be on a longer acting insulin, such as something like Lantus, that will work throughout the day. And then they will also be on insulin prior to each meal that they ingest. And that dose of insulin helps cover the carbohydrates and the glucose contained within that meal. So insulin's a whole topic within itself. Like I said, we don't have time to go into it today, but you can see we have a lot of different options, and really no one's diabetes medication regimen is ever going to be the same as the next person's. So how is treatment decided? So every year, usually around January, maybe December, we get a new set of guidelines from the American Diabetes Association. These are called the Standards of Care in Diabetes. And what these guidelines provide us is really great guidance in helping to choose appropriate treatment regimens for patients. They outline the goals of treatment, so A1C reduction, as well as other risk reduction. And they make statements taking into consideration other comorbidities that a patient may have. So if you have pre-existing cardiovascular disease, if you have pre-existing kidney disease, they'll make specific recommendations for those disease states as well. The other big thing that we always need to take into account with medications is the ability of the patient to afford them, especially if insurance prefers one regimen versus the other. And this can be one of the harder things to navigate. And I would always encourage you guys to reach out to your pharmacist, because they are great resources to help navigate insurance and funding. There's a lot of coupons and things like that for these medications that they can help guide you through. Another big thing is obviously preventing adverse events or side effects. We don't want to give a patient any medication that they are having issues with, as well as patient preference. So, historically, we've always said that patients tend to prefer oral medications because they're easier. A downfall of that can be that oral medications are usually dosed at least once or twice a day, versus some of our newer GLP-1 agonists, such as Ozempic, for example, is an injection, but it's just once a week. So kind of helping to navigate what's the best for each patient based off their lifestyle and their preference. So we're not going to go through this, but I did want to give you guys just kind of an overview. This is what those ADA guidelines look like every year. So you can see there's a lot going on here. But they do a really good job of, taking into account a lot of different things such as heart failure, cardiovascular disease, kidney disease, risk of hypoglycemia, so on and so forth. So if you're interested, just Google this, pops up pretty quickly, but you can see pretty all-inclusive. And as I said, they do make a lot of statements about treating comorbidities. So not only do we obviously want to treat diabetes, but we want to treat any other disease states that accompany it. So some of the major ones can be cardiovascular disease. Atherosclerosis or heart attacks, things such as that. So we'll use usually a combination of medications, so things that can help lower cholesterol, potentially antiplatelet drugs such as aspirin, and also control of blood pressure. Same goes for renal impairment or kidney impairment. One of our classes of medications, the SGLT2 inhibitors that we briefly touched on, can help protect the kidneys, as well as some of our hypertension medications, such as ACE inhibitors. These are drugs like lisinopril or ARBs, which would be a medication similar to losartan. And then last but not least, we also want to prevent those microvascular complications. This was the things that we kind of touched on earlier with our A1C control. So keeping glucose control ideally with an A1C less than 7, and helping to prevent things such as nerve damage, eye disease, so on and so forth. And then last but not least, just, my spiel from a pharmacist before we go. I think a big thing to remember is that we need patients to advocate for themselves and bring ideally a complete list of medications to all of your provider appointments, your hospital visits. We may not always know exactly what you are taking if you're filling it at various different pharmacies. So kind of keeping those documentations can be very helpful for your healthcare providers. A question I always get is, what do I do if I miss a dose? Unfortunately, I don't have a straightforward answer for all drugs, but in general, do not double up. But if you are ever concerned, definitely just pick up the phone, call your local pharmacy, and just ask for the pharmacist. They can usually help guide you. Storage, this is a big one, especially in Florida. I always tell patients the reason that your prescriptions come in that orange bottle is because that actually helps to protect against light. So it can help protect against the sunlight. It also is airtight, so it keeps out a lot of that humidity that we're very used to here in Florida. And it's also child and pet resistant as well. So you've probably noticed some of them are kind of hard to open, and that's intentional. I always tell patients, actually don't keep your medications in the bathroom. It's probably the worst place. It's the most humid place in your house usually. So usually like the top of the fridge can be a great option, anywhere that's out of reach of not only children, but also pets. And as I said before, my email address is on the screen. Feel free to reach out if you guys have any questions. There's a lot of information out there that we obviously didn't have time to go into, but if you have any specific questions, I am more than happy to help. And with that, I hope you guys have a great day, and thank you for joining me.